Listen up tonight. Pediatricians warn excessive noise exposure is a public health concern. They're sounding the alarm now over some common items our children and teens use that could have long-term consequences. 13's Melissa Bruner is on your side with how parents can take action in tonight's To Your Health.
Parents' warnings to turn it down are well-founded.
We're appreciating that it's probably becoming a bigger issue.
Pediatrician Randy Schumacher with Topeka's Cotton O'Neill Clinic says young ears are more sensitive to noise.
Just the size of the ear canals and the way that sound waves bounce around in the ears, they are probably more sensitive to certain frequencies than adults would be.
That can lead to permanent damage. A new American Academy of Pediatrics report found 60% of teens and young adults exceed the maximum daily noise recommendation for adults. The risk isn't just from one-time sounds like fireworks or sporting events.
It's not just the level of exposure, but how often they're exposed. And that's one of the reasons we worry about those listening devices and earbuds, because they tend to live in the kids' ears. And so that can be a chronic exposure at a higher level than we want and can really put their hearing at risk.
While many parents have accepted they can't silence those personal listening devices, Dr. Schumacher says you should monitor the volume.
If the person with headphones or earbuds in can't hear you talking to them at an arm's distance away, then the noise is probably too loud.
The AAP also suggests caution with sound machines used to calm fussy infants.
Placing it further away and at the lowest volume, that seems to work for that baby.
Dr. Schumacher says hearing is essential throughout our lives.
We know that kids that struggle with hearing, struggle with speech acquisition, struggle in the classroom setting. It just puts them behind the 8 ball as far as developing normally and succeeding in school.
In addition to turning down the noise, kids and teens should take listening breaks and use earbuds with caution. Plus, use ear protection when you'll be in a noisy environment.
The younger you start good habits, hopefully that continues as they get older.
Melissa Bruner, 13 News.
And regular hearing exams during annual well child checks can also help catch any issues early. We have a link to that AAP report and additional advice for parents on the health page at WIBW.com.